Hello everyone, this is Dr. West Connor, and today's presentation is on insomnia. And of course, there's a little cartoon here that these pills will help you stay asleep. They change your dreams into PowerPoint presentations. So of course, this is a PowerPoint presentation. According to the National Institute of Health, you've got 60 million Americans have insomnia, and insomnia increases with age. It affects about 40% of women and 30% of men and can result from you got stress, could be jet lag, your diet is out of whack, and of course the other. It could be stress at work, which you already said, but any other thing, the death of a loved one, several other different causes of insomnia. And of course, a lack of sleep will increase your mortality by 400%. Sleep is of course very important. We're going to go through some of the background stuff here, and then we're going to get into the nuts and bolts and get everyone to sleep here. Your body works off what's called the circadian rhythm. Basically, you've got 14 to 16 hours of awake time, 8 to 10 hours of sleep time, and this is, of course, dependent on sunlight. 500 years ago, we went to bed when it was dark and got up when it was light. Now we've got light bulbs and artificial light that sort of skew that time. So our bodies are not sleeping correctly. Like I said, 300, 400, 500 years ago, we would go to bed when it was dark. And now we're not keeping that certain circadian rhythm. You've also got SAD, seasonal affective disorder. This happens mainly with people up north, especially like in Alaska or something like that, where it's dark 24 hours a day for an extended period of time. Sometimes in the winter time, it's just gloomy and cloudy all day. The sun doesn't come out for weeks at a time, and it's dark, 18 hours a day, and it's only light for, 6 hours or something like that. And it affects your mood and you get sort of depressed. Now you think about, how do you sleep on vacation? When you go to Florida or the Caribbean islands or Mexico, you sleep great. Well, why? Well, one, you're relaxed, you're having a good time, and it's in the sun. You're in the sunlight, and you've got that circadian rhythm back. It's light, it's dark, it's light, it's dark. So how much sleep do you need? 6 to 10 hours is generally considered good, for proper function. Some people need just a few hours. That's pretty rare. And if you're sleeping more than 10 hours a night, you really need to see a doctor to find out if there's any underlying conditions that's causing you to sleep that much. Not enough sleep, and your body's going to run on adrenaline for energy. Adrenaline is coming from your adrenal glands, and they're pumping this out, and your body is using that. That's sort of a fight or flight thing. It's norepinephrine. It's adrenaline rather than the glucose that your body normally runs on. So improper sleep is going to mess up your hormones and give you hormone imbalances. Also, hormone imbalances cause sleep disturbances. So a lot of people are taking prescription drugs. A lot of people. I'm a pharmacist. A lot of people are taking prescription drugs for sleep. Well, they put you to sleep, but the problem is they interrupt your sleep patterns and they don't allow you to get into deep sleep. And deep sleep is when your body repairs itself from the damage during the day. Now you don't think you do much, but you think every time your heart beats, your blood vessels, your arteries your arteries are stretching from the blood pressure and then returning to normal size. Well, that stretching and returning and stretching and returning gives little small tears. Well, during the night, that's when you repair all the damage that you've done during the day. You don't do that. That doesn't happen when you're taking sleeping pills and you're not getting into deep sleep. Alcohol also inhibits that deep sleep and does not allow for proper repair. So are you getting enough sleep? How do you know? So the best way is really your growth hormone level. If your growth hormone is low, you're not getting enough sleep. That's your repair hormone. You can't check growth hormone levels in and of themselves. The half-life is seconds, so you won't be able to check it. What you need to check is what's called the IGF-1 levels. That's insulin-like growth factor 1. That's more stable for longer in the body. Therefore, you can check those, and that's an excellent indicator of your growth hormone levels. Your growth hormone, like I said, is your healing hormone. Without it, you don't heal. Growth hormone is released during deep sleep. There you go. So the first step in sleeping properly is what's generally termed as sleep hygiene. So you go to bed when you're tired and you don't lay there for more than 20 minutes. If you're laying there more than 20 minutes, do some sort of a boring activity. Read a read a pharmacy book. Those are boring. Read a hormone book. That's even more boring. But read something that's rather boring. Don't read an exciting, scary novel or anything like that. You just want to relax. During the day, don't take naps. Those are going to interrupt your sleep cycle at night. You want to have regular sleep and wake times. Go to bed at the same time, wake up at the same time. That gets you into a pattern. Avoid caffeine, nicotine, and alcohol, especially later in the day. That doesn't mean you can't have a cup of coffee in the morning. It's long gone by the end of the day, but sometimes that cup of coffee after dinner, that's going to stay with you and cause you to have difficulty sleeping. If you exercise earlier in the day. Now, this is something I do not do. I do not exercise early. I exercise late. I always have. I go to the gym around 7:30 p.m. I always have. That's when I like to train. So for me, exercising early is out of the question. But if you're having difficulty sleeping, that's a possibility. Avoid large evening meals. Again, you just have that unsettled stomach if you're eating a large dinner. You want to keep your bedroom dark. You want to establish a bedtime routine. Do the same thing. Your body gets used to the routine. And of course, use your bed only for sleep or sex if you're married or have a partner. And you want a pleasant and relaxing sleep environment. You want it peaceful and quiet. It's for sleep. That's what you want to do. That's step one is sleep hygiene. Your thyroid is your energy system of your body. So if your thyroid is low, it can cause you to sleep excessively, have excess sleep, and still be tired. And a high thyroid, if you have hyperthyroid, it causes you to be jittery and cause lack of sleep. So if you're having sleep issues, either sleeping too much or not enough, or having difficulty sleeping, you might want to get your thyroid checked. It's a simple test that any doctor can do. I do it at the clinic all the time, and it's easy. Simple way to check your thyroid. The TSH is what it's called, thyroid stimulating hormone. It's a broad test that just gives you a basic overall diagnosis of your thyroid function. But that's plenty good to see if you have thyroid issues. Now, melatonin tends to be pretty popular, but there's a lot of conflicting studies on whether it works or not. It does work well with children. Now, there's been a number of studies that say, yes, melatonin is great for kids, great for children, put them to sleep, works well. There's no toxicity with it. I'm sure you don't want to give your child tons of melatonin, but the top end dose really hasn't been established. So there's really no toxicity with it. I've tried melatonin. My personal experience is no matter what time I took the melatonin, I'd take it at 6 o'clock at night or midnight. It doesn't matter. I would wake up at 3:30 a.m. and be wide awake, ready to go. And after about a week of that, I said, no more of this melatonin. I don't know what it was. That was just my experience. Whatever time I took it, 3:30 a.m., boom, wide awake, ready to go. Couldn't get back to sleep. So, but melatonin is an excellent antioxidant. So it is good for you. It won't hurt you. What controls your body's own production of melatonin is vitamin D. So you need to keep that at a good level. Here we are with vitamin D. It's produced in the skin when your skin is exposed to sunlight. Older people do not produce it as effectively, and it helps with the circadian rhythm. Again, the sunlight during the day, no sunlight at night. So your body gets used to that light, dark pattern. Sunlight is critical for sleep. It produces that vitamin D. Now you want to be sensible about how much sunlight you get. Fair skin or darker skin. You just want to use common sense. Generally, 15 to 20 minutes a day in short sleeves and shorts are all you need to get the proper amount of vitamin D. It doesn't sound like much time, and it really isn't. And if you're going to spend extended times in the sun, there's controversy on sunscreen and whatnot. But in order for your body to produce as much vitamin D as it needs for the day, you only need about 15 or 20 minutes of sunlight. Vitamin D is not in foods for the most part. They have vitamin D enriched milk and whatnot. But for the most part, foods don't carry it. It doesn't need to because we were outside and exposed to the sunlight and we didn't really need it. Now there's a prescription vitamin D. It's called vitamin D2. It's ergocalciferol. And it's only about 30% as effective as the over-the-counter vitamin D3. I don't understand why anyone would want to get a prescription for it. It's available over the counter. The prescription is a manufactured vitamin D product. The over-the-counter vitamin D3, I feel is much better anyway. Um, it is toxic at super high doses, but it's very rare. There's very few instances of toxicity. You can even ask your doctor, have they ever heard of anyone overdosing on vitamin D? You just don't hear about it. But there is toxicity, and you just get nausea, maybe some vomiting and malaise, which is like a blah feeling. So in order to get your vitamin D tested and checked to see what level you are, you can only check the blood for that, and it's a 25 hydroxy vitamin D test. There's another test called a 125 hydroxy. You do not want that. You want the 25 hydroxy vitamin D. That's the proper test to get to check your vitamin D levels. Vitamin D is very important, and low levels of vitamin D are associated with breast cancer, prostate cancer, cancer of the colon, bladder, esophagus, stomach, ovaries, the rectum, renal system, uterine cancer, non-Hodgkin's lymphoma, cervical cancer, gallbladder cancer, on and on and on. The reason we say it's associated with these diseases, we can't say it causes these diseases, but those who have any number of diseases, these included, have low levels of vitamin D. So we can't say that the low levels cause these, but those who have these diseases have low vitamin D, if that makes sense. And again, low vitamin D associated with chronic disease, osteoporosis, colitis, multiple sclerosis, heart disease, etc. Again, people who have these diseases have low vitamin D, but low vitamin D doesn't cause them. But when those with these diseases are given vitamin D and their level gets up to like 70 or 80, the problems with these diseases go away. I can't think of the feeling that these diseases have. I can't think of the word right now. Of course, when I'm recording this, the word escapes me. The symptoms, there it is. The symptoms of these diseases decrease when the vitamin D levels get back up to 70 or 80. Low vitamin D also causes high TNF. TNF is tumor necrosis factor. Tumor necrosis factor promotes inflammation in the body, and this inflammation causes autoimmune disease like the osteoporosis, multiple sclerosis, things like that, rheumatoid arthritis. Low vitamin D is also associated with muscle pain. Again, food doesn't have enough vitamin D, and the dermatologists say you should avoid the sun. So what do? You need a supplement with vitamin D like we talked about before. So when you check your blood level, you want it to be a minimum of 50 on that 25 hydroxy vitamin D test. If you have underlying health conditions, diabetes, arthritis, multiple sclerosis, you want it to be at least 70. 80 would be even better. The toxicity level is 150. You're still not even half at 70. You're still not even half to the toxic level. So there's nothing to be concerned about. Now, what you could do is, as far as supplementing with vitamin D, what I do and what my wife does, we take 5,000 units of vitamin D a day. Orally, it's a capsule. It's cheap. Inexpensive. I think it's $10 for 90 of them or $10 for 120 of them, something like that. It's cheap. If you're having difficulty sleeping, you can try 2,000 units sublingually. It's a liquid, sublingually at bedtime if you're having difficulty sleeping. What that's going to do is going to give you a sharp increase in your blood level, and that vitamin D, you'll see later in the presentation how it causes you to become sedated and go to sleep. Another supplement is L-tryptophan. L-tryptophan is converted in the body to 5-HTP. 5-HTP is also an over-the-counter supplement. So 5-HTP can then enter the brain where it's converted into serotonin. Serotonin, quote unquote, calms the brain, so it calms you down. The dosing on this, 500 to 1,000 milligrams of L-tryptophan or 50 to 200 milligrams of the 5-HT. And you want to take it in the evening, maybe an hour or so before you're ready for bed. Another supplement, now my wife and I both take this also because, again, we work out at night, and when we get home, we're kind of exhausted. We want something to relax us. Magnesium is a mild muscle relaxer. It relaxes the whole body. We take 2 400 milligram tablets before we go to bed, so we take 800 milligrams. So the dosing is 800 to 1,000 milligrams an hour before bedtime. You can also take about a tablespoonful of milk of magnesia. Now, if you're having some constipation issues, this would be the way to go. This will also give you the right amount of magnesium before bedtime and help with your bowel movements if you're having an issue there. And with this magnesium, it may take a couple days to get your level up, but I find that I sleep much better when I take my magnesium before I go to bed. And Malia feels the same way. She likes taking the magnesium before she goes to bed. Some other supplements, valerian root and chamomile, they only seem to work when people know they're taking it. So it pretty much has a placebo effect. When they do blind studies, in other words, people are taking a placebo or valerian root or chamomile, there's no difference. The people feel better on a placebo because they think they're taking the valerian root. You can try it if you want. If it helps you, wonderful. Prescription product Gabapentin. The brand name for this is Neurontin. It's prescription only. It's got a ton of approved uses. But what gabapentin does is it gets into your brain. It crosses the blood-brain barrier, and this GABA, G-A-B-A, it causes relaxation. So in a roundabout way, it's a pretty good sleeping pill. Um, Again, the dose 100 to 400 milligrams at bedtime, and this is prescription only. Diphenhydramine. This is Benadryl. It's an antihistamine. And when you buy an over-the-counter sleep aid, almost all of them have diphenhydramine or dimenhydramine or another type of an antihistamine. And they cause sedation. They work great. The dose of diphenhydramine or Benadryl is 12.5 to 25 milligrams at bedtime. The problem with the diphenhydramine is many people have next day grogginess. In other words, their body doesn't eliminate it for 10 to 12, maybe 15 hours. So if you only need to sleep 8 hours, you've still got some active inside your body when it's time to wake up. You're still groggy the next day. Two more prescription products that work very well, hydroxyzine and trazodone. Hydroxyzine is another antihistamine. Um, the dose on that one is 25 milligrams at bedtime. It causes about the same amount of sedation as the Benadryl, as the diphenhydramine, but it doesn't seem to last as long. It seems to last about 6 to 8 hours. So I believe it's a better choice if you're going to go that route as far as to sleep. Another great sleeping pill, Trazadone. It's an antidepressant, but it causes about 8 hours of sedation. And when I was researching this, a lot of people who are depressed also have insomnia. People who have insomnia are also depressed. So if you fall into that category, trazodone is an excellent drug for you. Hormones play a major role in sleep. High levels of LH and FSH. Okay, luteinizing hormone, follicle stimulating hormone. Those are the signals in your body that tell your body to release hormone, if that makes sense. So low hormones cause high luteinizing hormone, high FSH, follicle stimulating hormone. Those are what give women who are going through menopause the hot flashes. Your body is screaming, I need hormones, I need hormones, I need hormones. And it's sending out LH and FSH. When those levels get to a certain point, that's when the hot flash happens. So if you have these low levels, this LH and FSH are causing some sleep disturbances. So if that's the case, you need to balance your hormones. And again, lack of sleep causes hormone imbalances. So if your body's in balance, you will sleep. I can't leave out sex when we're talking about ways to get to sleep. Obviously, for guys, this works much better for them, for us, than it does for women. We know after sex, we're ready to go to sleep. Why? Well, it causes our serotonin to go up. It causes our brains to just relax. It's a calming hormone, is serotonin. That's what happens when you take the 5-HT or the L-tryptophan. Your serotonin is going to end up going up. Sex causes serotonin to go up, especially in men. So here are the steps to sleep. Start with the sleep hygiene. We discussed that earlier. Go to bed at the same time. Have a regular schedule. No big meals. No caffeine. If that's not working for you, go with the vitamin D3, the over-the-counter. Actually, I think everyone should be taking vitamin D3 anyway. I take 5,000 unit capsule. My wife does also every morning. If you're having difficulty sleeping, you may want to try a 2,000 unit sublingual drop. Goes under your tongue at bedtime. That'll cause a steep increase in your vitamin D levels, putting you to sleep. Check your hormones and your thyroid. If they're out of balance, you're going to have difficulty sleeping. Next, 5-HTP, 50 milligrams, about an hour before bed, or L-tryptophan, 500 milligrams, about an hour before bed. Magnesium, I take 800 milligrams of magnesium before bed, or about a tablespoonful of milk of magnesia, or a swallow, something like that. It doesn't have to be exact. Still having some issues, move to the over-the-counter diphenhydramine, over-the-counter Benadryl. I would recommend starting with a 12.5 milligram tablet at bedtime. See how that does. See how your grogginess is the next day. Still having some issues, you may want to try the melatonin. 1 milligram. You don't need a high dose of melatonin for sleep. 1 milligram is plenty. Take it at bedtime. Still having issues, this is where the prescription drugs come into play. The gabapentin. Start off at 100 milligrams at bedtime. Speak with your doctor about this. This is a prescription. If you're a little bit depressed, maybe try the Trazadone. Trazadone is an excellent antidepressant. It's very mild, but it causes about 8 hours of sedation. And then the hydroxyzine, which is an antihistamine, 25 milligrams at bedtime. Again, it causes about 6 to 8 hours of uh, sedation and being tired. And if you take the hydroxyzine, stop the diphenhydramine. Those are both antidepressants. You don't want to take them both at the same time. If you have any questions about sleep, my email address is askwest@medicinecoach.com, or you can go to medicinecoach.com and go to the contact page and contact me there. Thank you very much.